Really?
Bringing now the mayor of the city of Boston, Marty Walsh. Mr. Mayor, thanks so much for joining us this morning. I know it's a very busy time for you. We've been talking to physicians from Boston, from across your city this morning, but also over the last couple of days about the circumstances inside those hospitals. Let's talk about, from your seat there in the mayor's office, what do you need? What's the state of play in Boston? And what more could the federal government be doing to help you?
Well, I think we need some more consistency across the country. I mean, as I watch the different shows and hear the different talks about what's going on, one state's doing this, one city's doing that, and I think that we need consistency in shutting everything down. And I think right now we have emergency orders in some place. In Massachusetts, we have a stay-at-home advisory. And I think that the hospitals are going to end up getting frustrated because they don't have enough supplies. And it seems like there's a wedge from getting things from Washington, D.C. And right now, quite honestly, and I haven't been critical of anyone, and I don't want to be critical because this isn't about Democrats or Republicans, but it's about taking this really seriously. We're seeing the United States, the number one country for cases of coronavirus. And we kind of, I think a lot of us would feel we got ahead of it beforehand. At least in Boston, we've been shutting things down for the last 2 weeks here, and the numbers continue to grow. So I think for people in Boston, what I want to see in my hospitals, I want to see medical supplies. I want to see medical supplies for my first responders. And I think we have to be more consistent across the board. I'll give you one example. In Boston, I shut construction down, and construction is essential around the country in so many places. And I don't understand that. We're shutting office buildings down, we're shutting everything down, but yet we're keeping construction sites open. I'm not saying emergency construction sites, that's a different story. But I think we need to get more consistent here.
So, Mr. Mayor, you've resisted the full shelter-in-place call that some cities have done, San Francisco, for example. Do you see yourself moving toward that now? It sounds like there's some concerns that people aren't adhering to exactly what you all have suggested. Are you looking at making that an order?
Well, what we're looking at now is we're working on how we carry that out here in Boston. And what we've done is, I supported the governor announced a stay-at-home advisory earlier this week, and I've been talking about that at every press conference, saying that it's incumbent upon us as individuals to do our part here. And if we adhere to that and only go out to go shopping or pick up prescriptions or maybe go for a walk and don't social gather, that we can get ahead of this situation with the virus. And I think that we won't know yet in Boston or Massachusetts how well that has impacted the numbers until, quite honestly, we're seeing a surge right now in numbers. Part of that surge is because of lack of testing last week. And then as we get into the weekend, into next week, we'll see what our numbers look like. But I do think at some point, if the numbers continue to grow at the rapid pace they are, and if you look at that map around the country, yes, it's the East Coast and the West Coast, but that map is starting to trickle into the middle America. We're going to continue to have serious problems. So the answer to your question, is, if we have to do that here, we will. But we need to make sure, and we've been putting this together to make sure that we have all the precautions in place so that we can get food to the poor, take care of our elderly, get medicine to people that are going to be sheltered. We need to make sure the infrastructure is there.
Mayor, I'm curious. Do you have testing that's taking place at hospitals? Do you have any hospitals that separate in separate buildings, new hospitals, makeshift hospitals, separate the coronavirus patients from other patients? And what can you do at your level to give people from the front lines a place to go to isolate so they don't go home and infect their families?
So I'll answer that a couple ways. Number one is we have we're opening up tomorrow, I think it's going to be ready tomorrow, a testing facility for first responders only in Boston. That's something that we don't have yet. We're setting it up. That'll be ready online tomorrow. We have a couple hospitals in Boston, one in particular that has a unit, an isolated unit, segregated unit for just coronavirus patients. And other hospitals are creating that opportunity. We're looking at, I think the Army Corps of Engineers is working with the state and looking at where do we set up a separate hospital for our homeless population. That's exactly what we're doing. We have a couple of areas that are going to have to be medically staffed, that as people have symptoms or test positive for the coronavirus, if they're not hospitalized, we're working with an organization called Healthcare for the Homeless, which is doctors and nurses. We're creating basically a space in a building for those folks that will be isolating, keeping everyone in this space that tests positive for coronavirus. That's something that we're doing here. When it comes to first responders, For our nurses and hospitals, doctors, what we've done is we've worked with the hospitals, and the hospitals are working with hotels to set up spaces for our first responders. And for on the city side, that option's available. And quite honestly, until you just asked me that question, I have a meeting at 8 o'clock. I'm going to go into the meeting. It's going to be the first topic of conversation. We do the same thing for our first responders, our EMTs, our firefighters, and our police to give them that option if they want it.
Yeah, I mean, is there any thought right now to separating out the population and giving these people on the front lines a place to live that is separate from their homes?
Yeah, and that's what I don't know if you caught that. What I'm going to do is we have it. The hospital system is working on that right now. And on the public safety side, we don't necessarily have that in place. But the fact that you asked me this question this morning, I have a meeting in a few minutes. I'm going to go in and talk about it.
Really?
Mr. Mayor, I think a lot of mayors, governors are grappling with this idea of how to eventually somehow get people back to work. I know you're hearing from the President of the United States that he'd like some places to open by Easter. I'll leave you out of that conversation. Just asked about your city because I think it's on a lot of people's minds. How will they know when it's safe to go back in the water? In other words, not just to go outside, but all these people that you know, friends of yours, I'm sure, your citizens, your residents who are suffering, maybe have to close their small businesses and fire employees because of what we're seeing. How are you looking at that balance of we want to keep the public healthy, but we're also losing jobs by the millions by the week, and also people are losing their livelihoods? How are you viewing that?
Well, I think that when we go back to work as a city or as a state or as a country, it's not going to be what happened. It's not going to be what we experienced 4 weeks ago. I think that the medical supplies, when I think about medical supplies for first responders and frontline workers right now, I think about how important that is. And I see a society at some point down the road, 3, 4, or 5 months from now, that we're going to be wearing masks. We're going to be wearing gloves. We're going to be very cautious what we're doing, because at that point, the coronavirus, we won't have a vaccine for it, and we probably will have hopefully some medicine we can take if somebody gets a coronavirus. But I think we still have to be very cautious, because at some point we have to restart the economy and we have to go back there. And when we do that, the virus is still going to be here. People are still going to be testing positive for coronavirus, and we can't have that surge. So I think at some point we have to start shifting over to what does life look like in America, and what does life look like, quite honestly, here in Boston when we return back. And I think over time we'll get back to normal and get back to a place where we were. But I think it's going to take some time for that.
Mayor Marty Walsh, thank you very much. And we're going to get more on Boston's fight against coronavirus when we speak with the president of Massachusetts General Hospital. That's coming up on Morning Joe. Plus, more on the breaking news from just moments ago. Prime Minister of the United Kingdom, Boris Johnson, testing positive for the coronavirus. Morning Joe will be right back.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.